Hi, my name is Dr. Lopez. I'm with Summit Chiropractic and Sports Institute in Spokane, Washington. So today we're going to be talking about low back pain in an athlete, which most commonly is an SI joint dysfunction. So some of the most common symptoms you're going to see with an SI joint dysfunction is going to be low back pain with specific movements. A lot of times it's when you're running, you're cutting, you're turning. That's when you're going to see that pain.
I think I like the sport of ultramarathons because running ultras is like a test of human endurance. Finishing a grueling 100-mile race is very difficult. Started experiencing some pretty severe lower back pain, and it started interrupting with my running and other aspects of life. When I first got to Summit, I met with Drew, and in less than 5 minutes he had thoroughly diagnosed my problem.
The low back pain in a runner is usually going to be an SI joint dysfunction. So your two SI joints are located off to the side of your spine. That's why when we're having low back pain, it's usually going to be on the right side or the left. One of the most common muscles that gets affected in an SI joint dysfunction is your glute medius muscle. One of the most important muscles in a runner, because that is the muscle that's actually going to give you your stability and your balance as you're running.
Summit Chiropractic set me up on some treatment plans, a series of stretching, as well as some rehabilitation exercises that strengthen those areas.
Preventative is key with an SI joint dysfunction, so we always tell our patients that before you start doing any activity is to be able to do some dynamic stretches to keep that SI mobile. So the first one we want to do is the air swings. So for the air swings is really to get some movement back in the SI joint. So you're going to bring your hip up into flexion all the way up to 90 degrees. You're going to keep your knee bent and you're going to swing back and forth about 15 to 20 times. You're going to switch sides and do it again. For the leg kicks, what you want to do is you want to start mobilizing your pelvis and your hamstring. So you go right side, kick, left side, kick. So the third one that we want to do is the leg cradles. So for the leg cradles, we're going to start activating some of our glute rotators, which are a huge part of your SI joint. Move up, kick, over, hold. What these are doing is going to help start getting some firing, some blood flow into that glute to allow that pelvis to mobilize a little bit easier. So for the fourth dynamic stretch, what we're going to do is a lunge. We're going to bring the hip, we're going to add the flexion, knee extension, drop, and go straight down. Now we're emphasizing more muscle group. Then we're going to do it backwards. So the backwards, we're going to emphasize more of your hip extensors and your hamstrings. So in this one, we're going to bring into flexion, extend back, drop, and bring the knee down. We hope the video was informative and that you learned something new today. And remember, here at Summit Chiropractic and Sports Institute, you don't have to be an athlete to be treated like one.